Hi, I'm Sarah McBane, and I'm one of the faculty with UCSD School of Pharmacy. My clinical site is in family medicine.
Hi, I'm Dr. Nathan Boehner. I'm Associate Clinical Professor here at the School of Pharmacy and a family medicine pharmacist.
What is ambulatory care?
I'd like you to think of ambulatory care as any setting where a patient can actually walk in to see that provider, which is different from inpatient or acute care where the patients are actually already in the facility.
Ambulatory care is really taking care of patients that are able to get places on their own, usually to see a physician for some kind of acute or chronic condition to be evaluated and treated.
What do you do in your clinic?
At my ambulatory care clinic and a family medicine practice, I work alongside physicians, medical residents, students, and pharmacy residents to manage their medications. That ranges anywhere from anticoagulation with warfarin, diabetes, where I'm able to sit down with patients, provide patient education, titrate their insulin, look at all their labs to evaluate it, and make recommendations and changes based on those labs.
My clinic is actually a family medicine clinic. It's UCSD 4th and Lewis, which is actually where we are right now. Here at UCSD 4th and Lewis Family Medicine, I see patients in collaboration with the different physicians here. This morning, we actually had a patient visiting the clinic for anticoagulation therapy management, so a Coumadin clinic type visit. However, because we're in family medicine, we can also address other problems for the patients. This particular patient is planning a trip for a ski excursion, and she's worried about her low back pain. We were actually able to work with the patient's primary care provider and provide her with a therapy that will help address that low back pain during her upcoming trip.
What would you like students to know about your clinic and ambulatory care experience?
Family medicine is best thought of as a traditional doctor's office where patients go to get their care throughout their entire lives. As a pharmacist, I work in collaboration with the physicians there to help make sure all of those patients have the best possible medication therapies. I see patients on a scheduled appointment basis in 15 to 30-minute intervals. In general, our protocols here are very, very open, and we have the capacity to address virtually any chronic disease that the patient has.
What I really want students to know about my clinic is there's lots of opportunities to see lots of different things. The physicians see pretty much anything from birth to death. There's newborn babies, there's pregnant mothers, young people coming in, middle-aged, elderly, people dying of cancer, people needing pain management, people treated for hypertension. There's all sorts of people. So the experience that you are able to gain is very broad, and you never really know what to expect. You really have to be open and ready and willing to learn just about anything. Really focused on a lot of chronic diseases. You really think about the long term. It's one of the major differences between an inpatient service and an ambulatory care service is that you really have to think long term about the patient and the patient's care because, part of ambulatory care is you see patients repetitively over a long period of time.